Let's talk about spironolactone. This is part of a larger acne series that I'm doing where we're covering contributing factors to acne, different treatments, etc. I'm going to give you the basics about spironolactone today. As always, I'm going to include some references if you want to learn more on your own. Today I'll be covering the oral/pill form of spironolactone, which is widely used for acne at this point. There is some emerging research about topical spironolactone. I'm not going to cover that today just because it's an expanding area of research and it's not very easily available. Spironolactone originally came to market as a blood pressure medication. Spironolactone is a diuretic, and diuretics were really the mainstay of treatment for high blood pressure for a long time. What diuretics do is that they essentially make you create more urine, and in doing that, lower the blood volume to lower blood pressure. So this was not initially created as a medication for acne. When they were giving this for blood pressure, an interesting side effect showed up, which was that male patients who took this medication sometimes developed breast tissue, so gynecomastia. So this fell out of favor as a blood pressure medication. However, over the years, it's been investigated as a treatment for other conditions where hormones really play a role. This includes conditions like hair loss, gender-affirming medical treatment, and of course, acne. A quick refresher about the role of hormones in acne. Androgens, aka what's classically thought of as male hormones like testosterone and others, create more oil production, and that can lead to more pore blockages. Spironolactone is thought to work in acne by blocking the activity of those androgens on the tissues, and also by a little bit of inhibition of an enzyme called 5-alpha reductase, and that is an enzyme that takes testosterone and transforms it into stronger androgens. In my experience, it is a very effective medication, especially in people who have hormonal acne. We actually don't have real randomized controlled trial data for spironolactone, and that comes from the fact that it wasn't developed as an acne drug and its use in acne is off-label. However, there have been a lot of retrospective studies where they looked at large groups of people who took this medication for acne, and it's been found to be really effective, especially in combination therapy with topicals. Just like with any other medication, there are some side effects to look out for. Like I said before, this is a diuretic, so it can lead to more urination. It can also lead to drops in blood pressure. It doesn't seem to really be that much of a difference in blood pressure in healthy people who don't have issues with that, but it's something to look out for. Anytime I give it, I tell my patients to pay attention to orthostatics, so that's feeling lightheaded or faint when going from sitting to standing or laying to standing. There is also some concern with this medication of elevating the potassium level in the blood. However, it has been shown that in young, healthy patients, this really isn't much of a concern at all. So tracking of blood electrolytes is really going to depend on the person, their age, and their medical history. Other top-line potential side effects include breast tenderness and menstrual irregularities like spotting. Generally speaking, this is a longer-term medication, so it's not like you're able to take a course for a few months and then get off of it. In general, it is something that people have to continue taking to maintain the effect until their acne goes into remission naturally. There has been some concern about potential risk of certain gynecologic or breast cancers that could come from long-term use of this medication. So far, there has been no real link between taking spironolactone and increased risk of gynecologic or breast cancers. What acne treatments or topics do you want to hear about next? Let me know in the comments.